Hello, my name is Hallie. I'm a nurse practitioner student and I'll be doing your exam today. Do I have consent to examine you?
Yes.
Okay, I'm going to perform hand hygiene. And what's your name and date of birth?
Trip 11, 03, 21, 98.
Okay. So from the outer view of this patient already, I see that he's in no respiratory distress. I see no cyanosis around the lips, no retractions, and no pursed lip breathing, no tripod positioning, which are all abnormal findings, but this patient is showing normality throughout his respirations, rate, and rhythm. Okay, so if you would please face that way and look at the posterior back a little bit more, if you can. A little bit more. There you go. Okay, so posterior view of the back, skin looks clean, dry, and intact. Turgor is appropriate for this patient. Texture is smooth. I see no edema, levies, nevies on this patient, no scarring, no bruising. I see no retractions from the back view of the patient, no signs of respiratory distress looking at the back. So, and skin texture is warm and normal for ethnicity in this patient. So, I'm gonna put my hands on you and just take a deep breath. Okay. All right, chest rise in this patient was symmetrical bilaterally on inspiration. All right, I'm gonna percuss your back. Hopefully me touch and kind of a little tap. So I heard resonance throughout the lung fields on percussing, which is normal. The lungs are filled with air and no exudate or fluid throughout the lungs. I did hear some dullness over here where the liver is located, which is normal within this assessment. So, all right, I'm going to palpate for CVA tenderness. So you're going to feel my hand touch on you and a little thud. Okay, you tell me if you have any pain or tenderness.
No.
Okay, other side.
No.
Pain or tenderness. Okay, I'm going to put my hands on you and you say 99. This is checking for tactile fremitus.
99. 99. 99.
Okay. I felt no increase or decrease in the intensity of the vibrations for tactile fremitus, which is normal. No exudate throughout the lungs, filled with air appropriately, bilaterally, okay? So, I'm going to listen to you now. Just take a deep breath with my stethoscope. Touches you. Okay. Okay. I'm hearing clear lung sounds. No wheezing, no rhonchi, no crackles. Okay. Lung sounds were clear in all fields. No rhonchi, no crackles. I heard no exudate within the lungs of this patient. And you haven't had any sputum production, correct?
No.
And if the patient did have sputum production, we would ask characteristics like odor, color, and consistency of the sputum. And also how often they're producing or coughing up the sputum. So, okay, if you will, turn around, look at anteriorly. And no obvious deformities looking from the posterior back, as well as the front. I see no deformity. Skin looks clean, dry, and intact. Turgor is appropriate for this patient. Again, no respiratory distress, no retractions, no pursed lip breathing, no tripod positioning. I'm going to assess rate of your respirations, okay? So I'm going to count for 30 seconds. I'm just hang on to your wrist. Okay. Respirations are 18 breaths per minute. 16 to 20 is normal, so he's within normal range for respirations. So I'm going to touch you just like I did on the back, and you just say 99, okay?
99. 99. 99.
Okay. So tactile fragmentus anteriorly on this patient, same as posteriorly. I felt no increase or decrease in vibrations in this patient. No evidence of exudate within the lungs, no effusion or fluid buildup in the lungs. So normal. Okay, I'm gonna listen to you. Just take a deep breath when I touch it with my stethoscope. Okay, breath sounds are clear. No rhonchi, no wheezing. I heard no crackles. So clean lung fields, which would be normal in this patient. And from the posterior view, of course, around this neck area here would be the tracheal auscultation through the midline of the posteriorly would be the bronchovascular, and then kind of these outer areas are the vascular areas whenever you're auscultating for breath sounds. So, okay, I think that we're going to move on to the your heart sounds. Well, read them one more time. Okay, symmetrical chest rise in the front as well in this patient upon inspiration. So now I'm going to listen to your heart sounds. Okay, I'm going to listen to your heart sounds. Just breathe quietly for me. So this is the aortic, right sternal border, second intercostal space. Pulmonic, left sternal border, second intercostal space. Herb's point, left sternal border, third intercostal space. Tricuspid, left sternal border, fifth intercostal space. And mitral, mid-clavicular line, left. Okay. And upon auscultation with the diaphragm, I heard no S3 or S4, only S1 and S2, no murmurs, no gallops in this patient, which is normal. I heard a normal rate and rhythm, a normal lub dub of this heart. So I'm going to auscultate with the bell. Same areas, aortic, pulmonic, tricuspid, Herb's point, tricuspid, and mitral. Okay. I'm going to palpate through the PMI, which is about right here, right where the mitral valve we listen to. Okay, I felt no thrills at the PMI. Rate and rhythm was normal. So I'm going to listen to your apical area of your heart for 1 full minute. Get a rate and rhythm. Okay, I got a rate of 75. Rate and rhythm were normal. Normal would be 60 to 100 if we're calculating your heart rate, even at the apical. So that would be normal. All right, so I'm going to get you to lay down on the couch. this patient in a lying position. I see no lifts or heaves within the thorax of this patient. Still, again, I see no labored breathing, no retraction. Skin looks clean, dry, and intact. Still, no cyanosis noted, and no increase in the breathing with this patient lying down, which would be normal. So I'm going to listen to you while you're lying down. Listen to your heart sounds. Aortic. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. Okay, and same with the bell. I'm hearing normal S1, S2, love dub of this heart, no gallops, no murmurs, and no S3 or S4s. Okay, and same with the bell. I heard no bruits, no murmurs, no gallops, only S1 and S2, so love dub, normal rhythm of the heart and rate. So looking at this patient, I see no jugular vein distension bilaterally. I'm going to palpate your jugulars. Okay. Normal rate and rhythm was noted in the palpate of the jugular. I felt no thrills within the jugular. So I'm going to palpate your valves of your heart, make sure there's no thrills there. Aortic, pulmonic, herbs, tricuspid, and mitral. Okay, and no thrills are noted upon palpitation of the heart valves. So, okay, I'm gonna make sure I didn't miss anything on you. All right, and if you want to sit up on the side of the bed, I think that we're about to finish up our assessment, so I'm going to go and talk to the provider, kind of come up with a plan of care for you. But all your findings today were normal or within normal limits, okay?
Okay.
Thank you for letting me assess you.